and welcome into To Your Health. And folks, I just love this man. We have got Dr. Will Rutland, a homeboy, a homegrown psychiatrist who is right here from our city. And I'm just thrilled that you came home.
Oh, wow.
And we talked last week about what we're doing, because we've talked about the problem,
Sure.
and people are seeing it all around them.
Sure.
But there's a solution.
There is.
One of those solutions is what the Montgomery UAB Medical School is doing in trying to establish a residency.
That's exactly right.
For psychiatry.
Yes, ma'am. So, we had talked about this previously, that what is happening in mental health here in Alabama, and certainly writ large across the entire country, is a supply-demand problem. So we have great demand for mental health services, but we don't have the supply of expertise to meet that need, but we're working to. And this is what's really exciting. As you mentioned, I am from Montgomery. This is my home.
Yep.
And so I always believe that Montgomery can meet any challenge with which it is presented, and I continue to believe that. And I am thrilled to be part of a solution that is in the works. You may know this about me. I am the clerkship director for the psychiatry clerkship for our medical students here at the UAB campus.
Right.
So I get to interact with the medical students frequently, and that is one of the joys of my life, because young learners are so activating. But we need to take that one step further, and the dean of that campus has a vision for how to do that. So Dr. Lou Lambiase is the dean over there at the Montgomery campus, and he had this sort of vision for our campus as being a center for psychiatry in the river region. Well, that covers a 26, 28 county region.
Right.
So there's a lot of demand there, but it is our plan to build a psychiatry residency. And just to kind of quickly go over what that is, after you do your 4 years of medical school, you're then an MD, and theoretically you can go out and practice as sort of a general practice doctor, but most new doctors go into a residency to specialize.
Right.
And so this would be a specialty training in psychiatry. It's a 4-year program, and we anticipate it's going to open up probably in July of 2024. And that'll put us with 12 psychiatrists in the pipeline by 2028. And that's really going to meet the need that we see. I want to be honest about this. It is a labor-intensive, maybe labor of love intensive effort to get a psychiatry residency up and going. And so we're going to need the help of our community to get it going. That's going to be both, facilities-wise. We've had a great partnership with Baptist South. But also we'll be coming out into the community to ask our neighbors to pitch in any ways that they can. And so I won't belabor that point too much this morning, but if y'all hear more from me, that's what it's about. We got to band together, and we can.
Well, we've got a problem we all need to help fix, because it's going to take a village.
It will, and we have one of the best villages in the world. So I'm excited about that.
Well, we will help you. And now we were talking about all the problems. What are some of these solutions, Will?
Such a good question. So, there are systemic solutions like the residency, building more psychiatrists, getting them out there into the communities. But then there are specific solutions as well. So, for instance, I often get the question, what do we do for something like dementia? Or what do we do for something like depression? What do we do for something like even bipolarity or psychosis?
Right.
You may know folks who have family members or loved ones who are living with schizophrenia or, manic depression. There are medications that can help. So a lot of this reduces down to the chemistry of our brain. And I'll try not to get too scientific here, although I love talking about this stuff. But if we think about the brain as an organ, which we don't often do, but it is. It is just an organ like, say, your pancreas is.
Right.
So I will tell my patients, think of someone with diabetes. Someone with diabetes has an issue where their pancreas, an organ, isn't making effective insulin, which is a chemical.
Right.
And because of that, they cannot sort of moderate their blood sugar. Well, in psychiatric illness, you have the brain, an organ, that's not effectively making a chemical. Oftentimes that chemical will be something like serotonin, which is what's at issue in depression. So we have an organ that's not making a chemical, and that produces disease. Just like the pancreas not making insulin correctly is producing a disease. And so we treat that issue. So y'all have probably heard of medications that work on serotonin, like the old school Prozac or newer stuff like Zoloft or Lexapro. All of these are serotonin agents. So they help the brain make that chemical and use that chemical more effectively. So just like you might take diabetes medication like metformin or insulin to help your pancreas do its job, our psychiatric medications help the brain do its job better. And they work. And they work. Now,
that's wonderful.
Now, I'll be honest, the brain is such a complex organ that we have to oftentimes sort of tinker a little bit to get exactly the right medication for each patient. And that can be frustrating for patients. But if we stick with it, we find the solution. We make sure that people feel better and do everything that we can to get them back to their full quality of life.
Now, what about, is there anything that can help with dementia?
Good question.
And Alzheimer's?
Such a good question. There are medications that can help slow the progression of disease. There are not medications yet that reverse the disease. So although we can sort of slow that curve down so that people retain their ability to function for as long as possible.
That's a godsend right there.
And there are a couple of different classes of medication that do that. And then simple interventions like social interaction is protective. Light exercise is protective. Taking care of your general health is protective. And so all of these things can influence our sort of cognitive performance. But there are not medications that reverse that decline. So we're still working on those, but we'll get there.
I love your attitude, and with that attitude and that love for what you do and for people,
yes,
you have that. And we appreciate so much you coming in and talking to us. And we are later on, probably as this progresses, going to have you back. And let me once again, for our audience, make sure that they know, how do we get to you to get help?
Good question. So to me specifically, I have a private practice that I'm part of out in East Montgomery called Gardenia Cove Mental Health. It's out across in this beautiful and new corporate park. Didn't even exist when I left for Yale, but now is there. It's right across from AUM. And so we're out there in the corporate park. You can look us up. We have a website and all that, and we would love to see you. We are there to be helpful. That is our purpose. So please look us up if you need to.
And your primary care physician can refer you, or in some instances you can walk in.
That's exactly right.
Okay. Well, thank you so very much. There's so much more to talk about, and we will get to that. We will have you back. God bless you, and thank you so much for being with us. And feel free to call us if you have some questions you'd like for us to go through too. We'd be happy for you to do that. 277-5000. Thanks for being with us. We'll be right back.